Hello and welcome to Bipolar Talk, the space to discuss all things bipolarity. I'm Clément Bessard, the founder of Upstage, and we basically help bipolar people live a better life. And we're really lucky today to welcome Dr. Lars Paschburg. How do you pronounce your name, actually?
Paschburg, but I just go by Lars. Nice and simple.
So the Dr. Lars Paschburg is German, I'm pretty sure.
Yep, father's German.
And we're going to talk, it's going to be really cool about like, how does it work with your GP, so your general practitioner? But first of all, I'll let you just tell me about yourself, Lars.
Well, I'm Lars. I'm a GP by trade, and I absolutely love my my profession and my opportunity to work in this field. I think it's a very underappreciated opportunity for us as doctors to kind of be that part with our patients and share that journey with them along a very long road, ideally. And so ultimately speaking, it's a wonderful journey for me. I love trying to make and solve real world problems. You know, I have a couple of other things on the side that we try and help each community. So I am absolutely thrilled at the opportunity to kind of hopefully share some good tips and tricks to kind of make an impact to your day to day. And hopefully that's something that can be taken away that makes something slightly easier. We're already making a win to live a better life.
Yeah, at the end of the day, that's the most important. So basically what I'm wondering, because like Australia is new for me, but even if you've been in Australia for a long time, what is the role of a GP? So general practitioner, right? So can you tell me what is your role and how does it relate to mental health? Because at the beginning of the day, almost all of us, as bipolar or not, will go to their GP and then we will be like, oh, maybe then we will need a psychiatrist. But at the beginning of the day, your relationship is really important. And can you tell me more about how does it work?
Yeah, so I'd say that I think the mental health field of medicine here in Australia, unless you're obviously in it, it's a fairly elusive kind of ethereal ideal because it's kind of like not talked about enough and it's not shared about enough. So it's not as mainstream. And so I feel like at every stage, a lot of people are kind of lacking awareness of how the system works. So to give it as my experience, what I would say is ultimately exactly as you said, your general practitioner or your first line of, I guess, connection into the healthcare system really is that. And the GP's role in a lot of mental health is basically speaking the one who starts really identifying that there's problems, that starts to see patterns, and ideally over time is generally considered, at least from the experience I've had working in the hospital of mental health kind of positions, they are the wealth of knowledge that we need from a medical perspective over a much longer period that sometimes the patient themselves don't have the ability to actually advocate or remember. So I'd say the GP's role serves as a number of facets. One is obviously the gatekeeper. One is the diagnostic thought, trial of simple things, trial of procedural kind of treatments and seeing how that works. And then at the end of it, generally speaking, would be the referrer with the right context. And so then also following referral, should that be needed, we as GPs, generally speaking, are going to be the one that's working with you, fine-tuning things, making sure that the preventative health and the long-term health is being maintained, stability, flare-ups, anything else. We're generally the ones to actually be participating with you in being able to monitor and manage that.
Something I'm wondering about is like, because as GP, you're trained to be like, let's say good average on everything, kind of. And it's like usually what I say about me as an entrepreneur, I say I'm average at everything. It's like I'm not, but you know what I mean.
Yeah.
And so for mental health, like what is your training and what did you learn and what do you think is your role as a GP?
Now, when it comes to, I guess, procedural training around mental health, I do believe there is a lot of requirements. And at least in my experience going through university, mental health is a component of basically the degree that is required. Now, I would say with almost every person, and GPs are a good reflection of this because our scope of practice is so broad, the baseline level of knowledge, or rather, I would actually say the perspective or the approach of what we prioritize, which is again looking at general well-being across the board, you know, specific types of conditions, specific entry levels, being able to fine tune and I guess you can call it pull that information out, really does depend on the actual skill set of the individual. Now, I myself have a very high level of interest in mental health. So I've had a lot of journey through, you know, a lot of the hospital placements. I work alongside my psychiatrist colleagues and learnt a lot over my time, as well as my patients, helping me to keep me up to date and feeding me back information. But I wouldn't say that necessarily every GP would be a good reflection of the same scope or interest, perhaps would be the way that I would describe it. Whereas a lot of GPs, generally speaking, would have enough to be able to, you know, identify the problems, support and structure, you know, referrals through to psychologists, referrals through to the actual specialist, investigate the first line, take a good history around these things. But there is a skill set that needs to be, I guess, respected and interest across the board.
Okay, and as a patient, like, how should I talk about mental health with my GP? Because usually, for me at least, like, okay, I've been for the first time to see a GP actually on Saturday because I have a little eye problem. It's
Mhm.
nothing, but I was scared. And to be honest with you, I asked ChatGPT. So ChatGPT told me it was fine, but I still wanted to see a GP. And basically, like, I wouldn't think too much about talking about my mental health problem, but and the GP that I saw was good because he really asked me quickly, like, do you have any condition? And I told him, yeah, I'm bipolar. And what was really interesting, it was like in a few minutes, it just told me, okay, do you have a psychiatrist? And I was like, no. So do you want me to prescribe your medicine? So it didn't took the role of a psychiatrist. But the good thing about it is I got prescribed like the pills I usually take. And then I'm like, I'm feeling better because I know that I have like ration for like 3 more months. But I know in 3 months, at least, I have the possibility to take more. But maybe you can do even much more thing with GP. So how should I'm talking a lot about my experience, but how should I work with my GP for mental health?
Hmm. So I think that there's a lot that we could unpack on that, but perhaps what I would do is kind of approach it on how would I get the first lot of, you know, the most impactful information to begin with. Let's say I don't have a diagnosis or I'm really curious about that. And then we're looking at kind of perhaps I do have a diagnosis, but are kind of looking to shift into a new GP. And then the other ones we can talk about with some variances. So perhaps the first part that I would generally start by saying is we kind of have to find a team that works for us. Now, ultimately, we're all going to be a little bit scared or concerned when we're actually approaching someone new around a topic that is generally fairly sensitive and a lot of the times fairly impactful to us. Some of us have had a lot of diagnoses or time frames where we've felt very disempowered and have not been taken seriously, and so that advocacy or that threat is definitely something that's going to have to be navigated. Now, as much as I would love to say that that shouldn't happen, we can't really avoid it. And so ultimately, what I would usually suggest is let's find the ways to be able to be the most clear in what we're actually conveying, be able to find more evidence to make your GP, no matter their skill set, more impactful. And usually, what I would do with that is kind of being able to bring a clear history or a clear set of data. And when I talk about data, is the same way that we look at it from a psychiatric point of view, where we go, hey, do you have evidence or logs of kind of how things have been over the time, the things that you're concerned about, the things that you be affected by, the impact to your life? And if we can kind of approach that, no matter how awkward or uncomfortable the first lot of conversations can be, we can at least get it noted, get it clarified, and start the ball rolling. Do we need to do some bloods? Do we need to send you off? Do we need to book a lot more appointments so we can sit down and really go through this properly? Ultimately, you may not find the right GP for you straight off the bat. You may very well find that not everybody fits. And that is part of the normal process, like you would finding friends, family, support groups. They're all people that we're going to have to find and trust. And that trust takes time to build. So ultimately, don't give up on trying. And if you are going to be bringing things, don't be afraid to bring a little bit more information, but also don't be afraid if they get you to come back to do a proper job. Because again, everything takes time to unpack. And so we got to respect that. If you want them to do it well, we got to respect the fact that they may not be able to do it straight away. And usually the ones that take the time are going to really be invested to really help you out. The next leg, I guess you're looking at, how do I kind of move across to another GP? And one thing that you mentioned is really actually quite nice, is that everybody kind of has a level of confidence, a level of skill, or a level of interest. Now, it sounds from that GP that you did see they respect the fact that they don't know enough about you to be able to jump in. And perhaps if you had given a little bit more guidance to, or let's call it cues, that you wanted them to ask more, they may very well have actually started to, I guess you can call it investigate or explore it. But a lot of GPs, depending on the skill level, will really be waiting for you to give them the cues unless you're coming with that as the main problem. So if you come in with a singular separate problem, they may not go and open it up because, again, it's a very large, important thing. They may not know you very well. They need to build that relationship in two ways as well. So respecting the boundaries is actually a really normal thing. So if you do want them to kind of investigate that, just say it. Be able to explore that, open it up, and then see what fits. So that's kind of my overall take. I hopefully have answered the concern. But yeah, that's the first two ways that I'd kind of fashion.
Yeah, it's true because like when you go and see your GP, most of the time you have like something clear in mind. And the good thing he was asking me is those little questions, anything else. It's really simple. And I went a little bit further, but I could have been more further. And you're right. It's just like ask and go and yeah, ask for solution. Otherwise, it's not going to do it. And so how does it work? So for example, I go and see my GP. We talk about mental health. Let's say how does it work, for example, for like depression? What usually as a patient, you're starting like you don't know if it's a depression or not, but you feel something is not right. You don't have a psychiatrist yet. And how should you approach things with your GP?
Hmm. Well, I think if we were to look at something like, let's call it more of a general, let's call it mood adjustments, be it anxiety, be it depression, be it kind of all a lot of the very, let's call it routine or simple mental health layers that do tend to affect a lot of us on larger layers. Ultimately, what I would say is that to just start broaching the topic. Now, if you are not very aware of it yourself and you're not quite sure what to write down or you're not quite sure how to navigate it, ultimately speaking, as GPs, that's actually one of our largest skill sets. We are able to help guide, we are able to kind of help, navigate you through and start working through it. But the most important thing that you can do is actually bring it up. If you're concerned about it, it's affecting you, you're worried, or you need some help around it, go and see your GP. Go and start actually opening the conversation. Even if you're not absolutely sure what to call it, you can just describe it. That's really what GPs are ultimately good at because that is our skill set, being able to navigate random symptoms that may or may not be connected, patching them together into an identified pathway of investigation, clarity, work-throughs, plans, solutions. And then we can kind of figure out where we need to go. Now, I believe here in Australia, mental health is actually more commonly managed by the GP population compared to the more, I guess you can call it severe or significant impact or high risk conditions those are generally managed by the psychiatrist, where I do believe in other countries, psychiatrists are probably a little bit more accessible. And so they're usually part of the mainstream management, but I can't really comment on a lot of those because I only work here in Australia.
I feel it's really important is like when to see a GP and when to see a psychiatrist. And I feel is if I look back on my life, I got my first depression. I was 19 years old.
Mm.
And at the time, I wasn't diagnosed. I just knew something was wrong. And I remember that sadly, I didn't have a GP that I can actually trust. So basically, what I did is my mom booked a meeting with a psychiatrist, and I went into the room. And after basically 20 minutes, he told me like, okay, just you have depression, take these pills, you're gonna feel better. But I didn't have the trust.
Mm.
And I I was like, you don't know me. Yeah, and I was young. I was also depressed, so my brain wasn't working properly. And I didn't trust the person, and I didn't take the pills, for example.
Mm.
And I feel like if I had the GP, like how to do it in a better way, because I feel if you have a connection with someone and you trust someone that you can see on regular basis, like how does it work with the GP and maybe the psychiatrist in the golden standard? How would you say it should work?
You bring up actually a really interesting point, and that actually is a very, very common problem with a lot of people, where if you don't know what's happening, you don't understand why something's being treated. What am I supposed to do with this tablet? What on earth is this name that you've just given me that I appreciate has meaning in a dictionary, but I don't know how it translates to me? Can be an extremely confusing journey. Now, ultimately, if I were to kind of pick my personal optimal goal on what I like to do and what I believe is a very good pathway forwards for a lot of people to try and navigate that more streamlined, is you need that GP, because to diagnose it and to clarify it, you actually need someone who is looking at it as a whole. And they do have to get to know you. They have to understand, what's your family structure like? What's your family history like? What is the actual kind of issues that have been going on? How is it actually affecting you? Why is it that this is a problem? Is it something that you're just feeling? Is it due to something that's happened? There's a lot of things that really need to be navigated and need to actually be explored properly. Now, if you don't feel like that's actually been explored in a 30-minute or an hour appointment, to really get a good idea of the grasp of your scenario or your life, naturally you're going to be like, well, it's kind of like the feeling that you go and get your car serviced and they just keep adding random things in, and you're like, but why have you added this in? I don't know what this is for. And don't get me wrong, it may still be the right thing that they need to do, but it's usually about the journey or the experience that is the most important. And so chances are the psychiatrist had a very, very, very good suggestion that was probably right for you, but it's about the journey or the experience that probably made that going, I don't know. And so ultimately, what I would say is that a patient should go and see a GP, and your GP is generally your management of your health, your wellness, your life, your family, your scenario. And they would be able to kind of work with you as a client or as a patient to try and navigate and understand that. Then, if it's required, or if there are kind of issues that are not quite clarified, or it's outside the scope or the knowledge or skill set of the GP, that's where generally referrals will happen, whether it does need to go straight to a psychologist for talking therapy, for further clarification from an in depth mental health practitioner, or straight over to a psychiatrist, where a psychiatrist is skilled at diagnostics management protocols and a very broad range, where they're looking at medicine from a very specific facet. That's the kind of journey that I would say. But ultimately, if you've got that kind of point of anchoring, that you've got support, or that you feel like you could talk them over without arguing with anyone, like, for example, I get a lot of patients that come back, they're like, my specialist has prescribed me this. I don't know what it's for. Is it safe to take? And it's going, well, your specialist knows exactly what they're generally talking about. And I spend a lot of time just doing the education around what is it? Why are they giving it to you? What are the probable reasons? What are we going to measure from that? And those make the big difference between you feeling like it makes sense or you're just going to leave it aside because it's something confusing.
Yeah, it's only about trust. Like what we found at Upstage is a lot about acceptance, and of course, having the right treatment is really helpful. And I'm lucky that I have a good one. But if I don't accept to take it every day,
Hmm?
then it just wouldn't work.
Well, you wouldn't be taking it and it wouldn't help. And a drug not taken is basically a drug not doing its work. And yeah, I completely agree with that. I think ultimately speaking, trust in the understanding. But I'd almost look at it from like a personal point of view, not as a healthcare or not as a condition. It's almost like we would with anything else in our life, you know? Do we need to get better sleep? Do we have good reasons as to why that is? I know for a fact every time I go to bed too late, I pay for it the next day because basically I've done something that is not optimal for myself. And so, if I understand that from my own perspective as a human being, I can understand the value as to why I should do things. You know, eating, sleeping, making sure that I'm staying up to date with all of the things like my vitamins, my minerals, my fluids, my medication. It all comes empowerment from me being able to trust that it makes sense as to why. And ultimately, that's really where that relationship is kind of, bridging that gap between knowledge that isn't general population nuance and my life. And why the hell am I here?
Quick break. Can you let us a review on Apple Podcasts or the platform of your choice? It really helps us break the stigma around bipolarity. Let's get back to the episode.
Yeah, that's a toughest thing actually. It's like because knowledge is one thing, but like putting it in place is probably the toughest. And it's why personally I need a lot of help outside
Mm,
because I need someone to help me. Like I have psychiatrists, a psychologist, a GP, and the peer helper. And I'm really lucky to have a whole team around me and to be able to have support for different things in a different way. And I think I was quite lucky with the GP I found on Saturday because I felt it was really smart and quick, and that's what I like.
mm,
But okay, I want to go a little bit back for someone like me when I was younger.
mm,
It's like I go and see my GP and I feel there's something wrong. And as a GP, you can do referral, which is awesome. But
mm.
how do you do this referral? And how, as a patient, I can help you do it properly? Because it's never easy, to find the right psychiatrist, the right psychologist. So, what information should I give you for you to do your job? And how do you do your job for that?
So that's a really good point, and I think preparation is key for everything. So, like I had mentioned before, how ideally to make your GP the most effective, I guess you can call it in their appointment with you, is bringing a lot of the information. So, information about yourself, information about what you've been dealing with, how long it's been happening, what tends to be the main concern, where does it impact you. Those are all really good, concise information that would be really easy for us to start targeting the right things. Then, what we also look at it is also going, well, what are your main questions? What are you worried about? Now, that may not be the same thing as what we're worried about, because ultimately, the medical field, we've got some rules and regulations of what we know and what we have to care about. Your health, your well being, whether you're safe, whether there's going to be any harm to you becoming of this. And that might take precedence to what you're, I guess you could call it, thinking about, those questions that you're going, I don't know what it is, and I want answers. And maybe I'm worried about this or this or this. But if you bring them, we can at least be aware of them and kind of house them into it. Now, when it comes to referrals, I usually find the best thing is that my patients have a say. Because ultimately, like we talked about trust, even if it's the most random thing, if I've picked someone that I go, you know what, I'd be keen on that, I've already got a positive focus towards going to that. And I have advocated for myself that I've had a say. Now, ultimately, if that's not the right fit, it's not the right psychologist, it's not the right psychiatrist, I don't feel there's a very therapeutic relationship there because I've made a choice in it, or at least brought some options. I'm not personally going to feel, as I guess you could call it, wasteful or like someone's done me wrong because I participated in it. So ultimately, I would always say, and this is what I typically do with my patients, is I recommend them to go away and actually go and do a bit of research. Now, it doesn't mean you have to go and make your decision by yourself, but it's still looking at it going, well, do you know what you would like to see in a psychologist? Do you want them to be male? Do you want them to be female? Do you want them to be skill sets in specific types of conditions? Do they have a nice smile? What is the random things that we all just decided? Because again, we have random things that we all value far beyond necessarily logic, but that would be picked, and that's fine. Whether we've got a budget, understanding we need to recognize that cost is part of a lot of the therapies and treatments we need to do. It's not the best thing that I love to have to talk about, but ultimately, if I send you to someone you can't afford and you don't tell me, I'll never know. And so we can't really get you therapeutically treated if you can't get there. And so all of these things need to be thought about, who, the what, the where, the how much. Do we have an ideal between, do I want to see them online? Do I want to see them in person? Is it urgent? Do I need to get myself sorted quickly and then we can deal with long-term therapeutic relationship later? Because if you're in a state like you were when you were 18 and perhaps things were really going wrong and there was a high danger or a high risk, we may bypass the long-term therapeutic relationship and just go, I need you to get help now. And so there's a couple of the things that I would say are, I guess you can call it flows or thoughts. So bring as much information as you can, bring your questions or your concerns. If you've got an ideal of what you would like to look for, whether it's a psychologist, a psychiatrist, or anybody else around that, there's a lot of mental health workers, social workers, and places like that that are doing amazing work helping out with patients. If you've got some ideals, go and do some research, bring them as options. Ultimately, we are the ones that have to write it, but I personally think, on my own approach, that we all have the right to actually say, and if I've got a good reason to send you to someone else, I should generally be able to justify that. Hey, no, this one here is this very high specialist in X, Y, and Z. They'd be able to really get you sorted at the very least for the time being, and then we can work forwards. If you don't like them or if you're not having a good experience, we can shift it here. We're quite lucky in Australia. We can actually go and see whichever specialists we would like to, as long as the referral's in place.
Yeah, it's, I think, really something that is underestimated, as you just say, Lars, is like preparation. It's like, actually, I did it well that much on Saturday because I was scared. So I went into the meeting just thinking about, okay, I want to know about my eye, but I could have go a little bit deeper and be like, because I also got a prescription, for example, for melatonin, because it's what I used to take, because sometimes when I feel my sleep is not doing well, then I know it helped me, because if I let my sleep go badly, it has a lot of problem for me. It's like, of course, the next day, but it can also be the beginning of, for example, hypomania or this type of thing. And basically, like, so I think it's a really good thought, but what I want to know also is about treatment renewal, because at least in France, there's not enough psychiatrists. So a lot of time you live in a place where you cannot see a psychiatrist like more than one every 3 months. Well, some people, they are bipolar and they don't even have a psychiatrist. And there's this thing about treatment renew, so getting the same treatment, but also maybe change treatment because of side effects. So how do you do it as a GP? Because it's it's always a difficult question, but we're not in a perfect world, and sometimes. So, what would you say, and how we can do it like as best as possible? So, giving you a lot of information,
Mm,
but
yeah. So to kind of explore that a little bit more, and I look ultimately to speak to the idea of what would you do about the actual medication itself, that does depend on the skill set, and that does depend on the team that you've got. But if let's look high level, like what's useful for all skill sets of GPs and comfort levels, ultimately speaking, the first step is really exploring what are the concerns, you know? And so if you're feeling like treatment has been engaged, and at some point either it never really reached full treatment, or let's call it therapeutic benefit, the questions there is it meeting your recommendations, or is it meeting what the actual medication was designed for? And you've probably experienced this yourself as well, where sometimes we kind of overestimate what the medications are designed to do, like the classical happy pill. A lot of the medication basically aren't designed to make you happy. They're designed to help work on a biochemical basis and kind of help support you in your mental health and stability. But we still got to put a lot of work in ourselves to kind of, keep ourselves well. Like you said, the sleep, like you said, like we talked about before, about routines and structure and getting the right support networks around. But back to the medication, we kind of really need to explore. So what are your concerns? When did they actually start coming up? Have they changed? When did they start happening? And if you're having a lot of side effects, was it there from the start? And that kind of brings a lot of questions. So again, if you're worried about these things from the get-go, make sure to ask. Whoever's starting those medications generally would start a therapeutic balance here with you to be like, start it, review it. What's it working with? So don't forget to mention, we may very well be happy to go, look, that's acceptable for now. We just need to get you stable. We'll figure it out. But again, following it and tracking it is really important to be able to kind of identify going, well, is it the medication? Is it something else? And that's again where a lot of the GPs are really good, because we're very good at looking broader than a singular topic. Could there be other stuff that we need to look at? And we would broach that topic by really trying to understand the concern first. What is it you're concerned about? If it's side effect concerns, perhaps things that are a little bit embarrassing to talk about, well, we kind of need to know, otherwise we can't explore it. If there needs to be a change of medication, a lot of that normally works in let's call it a relationship or a dynamic with the patient. Because anytime we're changing anything, especially when it's stable, it comes with risks. And so we really kind of have to have a good plan laid out. And as long as everything is stable, we've got time. And so you can work out what the best plan is. So if we're going, yep, okay, your GP may not have quite the right skill set or interest level to kind of work there, or they might be a little bit harder to navigate to get to, a discussion should be had and planned. Maybe you do need to go and see the psychiatrist again to review it. Wrong dose, wrong medication. Maybe it's actually something else that started to come up as we've stabilized other things that you're going, oh, maybe there's something underlying. Maybe I need to go and explore some other concerns that could be there. But you can see that it's a very broad topic. And so ultimately speaking, the only way that you can really broach it, explore it, talk about it, and don't be afraid to actually mention it, and just understand that we may not have an answer straight away.
Yeah, it's really about stigma also. It's like really like it's fine, and it's why you're listening maybe is like, for example, I'm bipolar, and it's fine to talk about it, because talking about it for me helps me be more stable, because then people can help me easier, because they will tell me that, hey, is something wrong? My GP can help me, my psychiatrist, most psychiatrists will know, but at least I can talk a little bit deeper. The next question I had, because like you're talking about like referral, but how do you work with the psychiatrist of the person? Because what I figured out for myself, and it's not perfect as I wanted it, if they can communicate with each other and has each other basically phone number, if something happened, maybe they can help each other, So how do you work with psychiatrists of your patient, and how would you like to work with them? Because I found it's most of the time the problem is you're not paid by patient in France, you pay by meetings. So time that you spend on your patient outside is not paid. And sadly, it's like we're all trying to make a living. And basically, most of the time, people ask us to do, at least in France, to do a lot of meeting because it's how it's supposed to be in a way. But okay, what is your thought?
So it's a hard thing because we actually run under the same problem here. We are only paid for the time we actually spend with the patient. And so a lot of the times we do need to try and be as effective as possible. Now, we've got a lot of really good general systems that run where if you are referred over to a psychiatrist, that psychiatrist will generally write reports back. And ultimately, I would say that on a, I guess, straightforward level, the communication really is about optimal referral and optimal actually letter back. And a lot of the times we can convey fairly appropriate, timely information that way. Because again, everybody does read them, at least I do. And it's really important to get the other facets of conversations, or let's call it medical patterns or paths or plans that we're putting in place from doctor to doctor. When we're looking at other things, perhaps more urgent stuff, it really also depends on the doctor themselves, whether they're needing to call the on-call doctor at the hospital, whether you've got a specific psychiatrist that they do have a relationship with, that we would be able to basically call the offices and see if we can get a hold of them. And generally, when it comes to urgent things, I can't speak for everyone, but ultimately we generally make things work, because at the end of the day, if people's health is actually at question, it kind of just needs to be done, which is the hard call. Generally, we are a lot of the ones eating that, so to speak. But the other thing that I would typically do is, again, always upskilling my patients, because at the end of the day, a lot of that clarity comes with the one person who it's the most important to. Your life, your knowledge, your understanding, your team. So the collaboration is usually around that, where I spend a lot of time going, hey, make sure you're talking about this. Make sure you're asking about this. Make sure that you kind of sit down and you advocate for yourself. If you're talking about this is a worry, you can do that. Now, ultimately, it would be really good to be able to call up someone and whenever you're doing things. But I'd normally say that your team is looking at different facets. So a psychologist is doing a lot of kind of, talking therapy with you. Your psychiatrist is probably looking more of a medical or a drug management kind of processes and coordinating clarity around diagnosis or what's going on and safety levels. Whereas a lot of the GPs are generally looking at just it as a whole and how do we keep you safe, preventative health, doing all of these other ones. So ultimately we are all looking at different facets. So I find the person at the center, which is the patient, the more that you are upskilled to be able to advocate for yourself and know how to communicate your needs, that'll do the best with being able to try and coordinate between those, the team.
Yeah, it's at the end of the day, it's what we say. We are responsible. Of course, we're not lucky to be bipolar, but at the end of the day, nobody is going to do the journey for us. And to victimize ourselves and tell themselves, okay, it's not our fault, people have to help us. It's like you have to do the thing yourself. It's like your psychiatrist can help, your GP can help. But at the end of the day, if you don't talk with them, you don't tell them what you think, or you don't take your pills, or you don't even see them. Because I remember, like, my last big depression, I didn't even want to see my psychiatrist because I was like, I didn't like it, It was like I had to get out of my place. I had to, it's like, it was tough. But if you don't go and see a psychiatrist, it's not going to be able to help you. So, yeah, it's tough, let's be honest. But it's also why we're here to help, because sometimes it's easier to to be able to listen to some other people who did it and to be like, okay, this is how I found this problem. One of the things I wanted to talk to you about, Lars, is about the support from loved ones. Because as GP, do you usually have like patient and their family, or how does it work usually?
I think that really depends. That depends because, again, ultimately, it really comes up to the family or the patient themselves of whether they're involving them or not. Now, medico-legally, we can't really start calling up the rest of your family and start having a chat about it because, well, number one, we are going to get in trouble, and that is a very large breaking of trust unless there is a clarified reason for it, like, for example, an age problem. But again, ultimately, that really just needs to be explored about. So it really comes to, again, how would you as an individual like to be better cared for? And, let's bring in the rest of the family. Ultimately, as a GP, we're there to kind of help and facilitate, and it's very hard to navigate that otherwise, again, from a funding point of view and a permissions point of view, to be able to help. But I do spend a lot of times where a lot of my patients with mental health, they'll bring in their loved ones. And sometimes, especially when they're finding, let's say, for example, the brain's not working as good, they're going, I can't remember this conversation as much. So they bring an advocate in with them to be like, hey, can you help me understand this? Can you help me reinforce this? Can you help me kind of put some of these things in practice into our home life? And, a problem where it's shared in the intervention of it can sometimes be a little bit easier. And really, it's up to the individual to bring them along. And ultimately, as a GP, I always wish there were easier ways for me to help embed or get that support group in easier. But ultimately, it kind of comes back to the point that you made just before of going, it's our journey and we have to find ways to be able to advocate for it. Because at the end of the day, as crappy as it is that it exists, it's still within our scope to do something and make it what it is. It can be really bad if I don't look after it. I can be really unsupported if I'm not actually getting the help I need. I'm not going to be understood or helped along all of these things. And yeah, that's very valid and very true for a lot of people, and it sucks. But ultimately, there is still hope. There is still a lot of things that we could do and get treatment and get the right supports and get the right preventative measures, because it's a lot easier to get ourselves well and keep ourselves well than it is to keep jumping up from a really low level, because that takes a lot of effort. And so really the first step always is to kind of be able to acknowledge it, but also acknowledge the fact of anything that I do is going to be worth starting. And as much as it is kind of horrible, in the same way with everything else that we do, they're all just different problems that we theoretically have to explore. It's a matter of whether I choose to be able to make it my own life and make it as good as I can make it, or am I choosing to leave it alone and not getting the support and then suffering for that choice as well? It's not a good thing, and sometimes people are in very dire circumstances that they can't make a lot of positive choices, but we're talking about the ones that basically can do what they can do. Anything you can start is worth it.
Yeah, and that's something that was tough for me, is not feel guilty when I wasn't doing anything. To accept that at least I'm lucky now because it has been a few years, but I remember like 10 years, 15 years ago, it's like sometimes your brain just doesn't work how it's supposed to be. And you're so much anxious about everything. And even asking for help or even responding to a text in my situation or opening the door was impossible. I couldn't even open the door like to my friend. And so I really think it's important to explain like what I've been through, and that you shouldn't be ashamed. It's like just sometimes our brain doesn't work, but then you will have this window of opportunity, is what I call it. And in this window of opportunity, without putting pressure, but you're responsible to ask one. You're responsible to go and see your GP. And I would be lying to say that on this window you should chill, because it's what I see most of the time. It's like you really have the depression, it's horrible, and then you finally feel better, And then you're like, okay, cool, I don't have to do anything anymore. No, it's the opposite.
Yeah.
Like, that's the moment you should actually go and do stuff.
Yeah.
Because then maybe you're going to go in manic phase, and then same thing. It's tough to do anything about it because then your brain doesn't work normally anymore. I wanted to share that, but I see you agreeing. Do you want to put anything?
Yeah, I was going to say it's a hard call, and it's definitely a very valid thing. And ultimately, a lot of us, just when things are not as bad, all we want to do is just forget that they were. But that's probably the worst way that we could ever get the right help, because, and especially, look, maybe the first time, perfectly reasonable. The second time, perfectly reasonable, because logically you don't think it's a problem. Maybe you think it's just a singular moment. And this is where I talk about the notion of the history, the evidence. Because what happens, and especially with bipolar as a good example, it cycles and it will cycle. And there is very clear cycles that are the evidence that we need to help you help yourself. And doing it at a time where we have the capacity to do things about it are the times where we need to build the skills, get the diagnoses, get the history, get things stabilized. Because like I said, prevention is way better than cure. When you're actually in those cycles and you're in those bad places, whether they are hypo, or any other combination in between, it is hard. And again, we can't sit there and blame ourselves for that hard, because a lot of the times it's not entirely a notion of fault. But the thing that we can do is always make good use of the times when we are well to make the most of it and get the help. And if you have some opportunities that you're starting to build up with a relationship with a doctor, a GP, ideally, if they see you over these times, we could start being a little bit of an advocate for you as well. Just going, hey, you're not looking great today. Is there something going on? Hey, there's something that feels a bit off. Has this been something that's been going on for a little bit longer? We can start helping by asking those questions. But if we don't see and we don't know and we have no inkling, we're only as good as the information we have. So when you feel that there is energy to be able to do something, take the opportunity to go and seek help, or at least start the ball rolling.
Yeah, I like it. One last question, Lars, is like, if you have a magic wand, what would you change in mental health?
Oh, if I had a magic wand, the solutions would be phenomenal. But ultimately, if we looked a little bit more realistic, I do wish that a lot of things were a little bit more accessible, because I do think, especially with mental health, when you've got that window of opportunity, things are hard to try and line up. And there is a lot of navigating that is hard to do. You know, I don't know how to start the booking. I don't know which GP practice I'm supposed to book in. I don't know what I'm supposed to look at in a psychologist. I don't know what I'm supposed to do for myself right now. All I know is there's something wrong and I need to get help. And so if I could, wave a magic wand, things would be a lot more accessible. Things would be able to be a little bit more supported. That would be a perfect thing. In a perfect world, you could kind of have this like a one-stop shop where things are a lot more, I guess you could call it, beneficial. But ultimately things like, the education of our community, the education of patients who are going through it, are effectively solving that magic wand kind of solution anyway, because the better we make that educated, the better those little steps are going to be regardless. And so ultimately that kind of thing is effectively my magic wand. I just wish it was a little bit more accessible.
Thanks a lot, Lars, for your time. It was awesome.
My absolute pleasure. It's lovely to chat, and I hope everybody's journey just gets a little bit easier with a bit of the tips and tricks.
To learn more about bipolarity, go to our website, hopestage.com, hopestage.com. See you soon.